Welcome, everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Shijie Cao. Dr. Cao is a highly skilled veterinarian with about 10 years of experience in the field. He received his MS degree in veterinary medicine from the National Zhongxin University in Taiwan. Dr. Cao's expertise lies in the area of internal medicine for small animals. In 2023, Dr. Cao founded Carton Veterinary Hospital in Hangzhou, China, where he continues to provide excellent care to animals and also conduct training programs for young veterinarians. Today's lecture will introduce feline hepatitis lipidosis. This is a common and life-threatening liver disease in cats. Dr. Cao will provide comprehensive information on the diagnosis of hepatic lipidosis and will discuss 10 essential rules to help you manage the disease effectively in this lecture. Without further ado, let's welcome Dr. Cao.
Okay, thank you for your introduction, Robert. Can you hear me still? If it's clear, I hope it's so. So
Yes.
okay, great. So let's start today's topic. We're gonna talk about the optimizing care for cats with hepatic lipidosis. There would be 10 rules to follow, and I'm Shijie Cao, or you can call me CJ. And feel free to ask any question if there's anything you didn't clearly, or if you have any question, can just type your question in the box. So today, I'm gonna start with a case. This case is a cat. Her name is Captain, and she is a 5-year-old female spayed domestic short hair, and she has been present with anorexia and lethargic for about 1 month, and she has weight loss, vomiting occasionally. The owner noticed the cat's skin also getting yellow. There is no reason why, and haven't been noticed why this will happen. And the owner just sent it to the other clinic, received the liver treatment for about 1 week, but there is no improvement. So after that, the owner decided to send the case to me. And once I saw the case, I saw Captain. She is pretty dehydrated. The dehydration is 8%. The body weight is around 4 kg, and the BCS would be 4 of 9. There is a moderate muscle loss in this case as well. And the body weight would be previously 1 month ago is around 6 kg. Right now is 4. And the body temperature is 3.7, a little bit lower than normal. Systolic blood pressure would be okay. Skin membrane and the skin color would be jaundice. It's pretty yellow. Through the abdominal palpation, and there is almost nothing can be feel. The stomach is empty, the intestinal is empty, the lung sound, the gum sound is okay, but she has moderate gingivitis as well. And through the physical exam and the history, we can say the cat is in a jaundice, is jaundice cat. For a jaundice cat, there is a allegory for how we evaluate a jaundice cat. First, we need to perform the CBC and biochemistry to see if there is any truly hyperbilirubinemia. And we need to know the number of the total bilirubin as well. And the second, if there is truly have jaundice, the total bilirubin is higher than normal, we need to see the HCT or PCV as the next step. Is showed here. So if the HCT is lower than 15, then we will consider it's may caused by prehepatic jaundice. What is prehepatic jaundice? So commonly in the in the red blood cell, there is many hemoglobin. If the hemoglobin being digested or being by metabolized in the liver, the bilirubin will getting higher. So if there is now some like hemolytic disease like IMHA, the rupture of the red blood cell will cause bilirubin increase in the blood as well. And if the PCV or HCT higher than 15, then we will do the abdominal ultrasound to see if there is any like hepatic jaundice or post-hepatic jaundice. What is post-hepatic jaundice? Which means like the bilirubin duct or the bile duct has been blocked. Doesn't matter if caused by stone or tumor or severe inflammation. If the bile duct has been blocked, then will cause a post-hepatic jaundice. But what we will find through the post-hepatic jaundice, the ultrasound, we will see the bile duct or the gallbladder will getting enlarged, will getting dilated. And also sometimes we can see the the junction with duodenum, there's some mass or some stones there. And today we're gonna talk about hepatic lipidosis. So we're gonna see more about if there is any parenchyma, the liver itself, there are some issues. If the bile duct or the gallbladder is not dilated, then we will go to see if there's like more due to like pancreatitis, we need to rule out pancreatitis, or if there's any truly liver disease itself getting wrong. So there is other tips or other clues we will find through the bilirubin test is if the jaundice is caused by the prehepatic issue, the bilirubin commonly the number would be 50 to 100. And if the bilirubin is around like higher than 200, then more likely the jaundice is due to hepatic or post-hepatic issue. Why will hepatic problem or the liver disease will cause a jaundice? Because like hemoglobin will be metabolized by liver. If the liver is not working properly, then the bilirubin will getting higher. And also the post-hepatic jaundice is due to the blockage of the bile duct. Then the bilirubin cannot be excreted to the intestine, then cause the bilirubin getting higher as well in the blood. Okay, so for case like Captain, what we gonna do to analyze, what we gonna do next step once we saw she's pretty dehydrated and jaundice cat, we will do blood work first. There is a minimum database includes CBC, serum biochemistry, urinalysis, and blood pressure, T4 if it's an older cat, and FELV, FIV. And commonly we will see the urine will turn to orange as well because of there are many bilirubin in the urine. And this is a lab work. Okay, so here may be easier for you to see the values. We can see the white blood cell getting higher, hyponatremia, hypokalemia, and hypochloride as well, and blood glucose getting higher. Also, the creatinine and the BUN high as well. Also, some liver enzymes, ALT, gamma GT, total bilirubin. There are many off-range values in this case. So we need to analyze step by step. So first, I'm gonna look at the kidney levels. Why will the kidney level getting higher? It's due to the pre-renal, renal, or post-renal. We can see the USG is in the normal range. So it's less likely due to the renal disease, because if the kidney itself getting bad, the USG will getting low, and combined with the captain is a dehydrated cat, so and the USG is normal, so I would say it's more likely due to the pre-renal, due to the dehydration, cause renal parameters getting higher, and definitely we do see the inflammation in the body. We need to check what makes the inflammation happens later. And the electrolyte doesn't matter, the nitrogen, chloride, and the potassium all getting lower. Depending on the history, she didn't eat well for about 1 month, so I wouldn't be surprised to see the potassium or the electrolyte lower than normal. Higher blood glucose may due to diabetes, but it's also very easy or also very often to see in a pretty stressed or pretty sick cat. Once they getting stressed, once they getting uncomfortable, getting painful, the blood glucose will getting higher as well. And for the liver parameter here, we can see ALT getting high. It's more correlated with liver itself. And we can see the gamma GT, it's correlated with the bioduct system, is high as well, and a pretty high total bilirubin. It's more than 200. So I would say it's more likely due to hepatic disease or post-hepatic disease then cause a jaundice happens. And also we can see the bilirubin in the urine as at the same time. So next step I will do is ultrasound, flow the step by step. What we can see is liver itself is getting bigger, and also a little bit sludge. This is a gallbladder. There is no enlargement or dilation of the bioduct, but we can see there are some sludge in the gallbladder, and also we can compare to the spleen. The echogenicity of the liver is getting much higher compared to the spleen. Why the echogenicity of the liver would be important? So commonly, what is a normal echogenicity of the abdomen in cat? The highest would be the spleen, and the liver would be lower a little bit, and then would be the cortex of the kidney. At this case, captain, the echogenicity of the liver is much higher than the spleen. So the primary diagnosis for this case would be the hepatic lipidosis. because there are many fat tissue in the hepatic cell, and will cause the specific change in the ultrasound. We can see the area more close to the probe would be higher, and the distal part, the far field, the distal field would be lower, because the beam of the echo would be absorbed in the liver fat tissue. So this area will getting higher, the echogenicity, and this area getting lower. This is a very important imaging features of the hepatic lipidosis. So commonly, we saw this imaging, and combined with the history, she's a jaundice cat, and with a long time not eating well, and also we do see the liver enzyme getting higher, and also the total bilirubin getting higher. We will give a tentative diagnosis as a hepatic lipidosis. Why will hepatic lipidosis happen? To be honest, the pathogenesis is not clear enough. But commonly, what kind of patient or what kind of cat would be more easily to see hepatic lipidosis? Generally, it's from a the fat cat would be more easy to develop hepatic lipidosis. Once, like, even for some cats, they are not eating well for several days, even for like 3 days, 4 days, hepatic lipidosis will happen. Because once they are starving, the body will need to use the energy, but mainly from the fat tissue. And the body will metabolic fat tissue will make the hepatic lipiditis, and use liver to metabolize this fat tissue to make energy. But body cannot, because there is no enough energy, especially the protein, will make the liver do not have enough energy to make the fat tissue leave the liver. It will accumulate in the liver cells, make the hepatic lipidosis happens. Once there are more and more fat tissue accumulated in the liver cells, will make the liver cells getting swollen. Once it's getting swollen, the bile duct cannot exaggerate enough the bilirubin, and cause the jaundice happens. So that's the pathological reason why will the hepatic lipidosis happens. So once we know the tentative diagnosis would be a hepatic lipidosis for captain, then what we will do next step. Will you plan to do a liver cytology or histopathology to confirm if it's truly a disease, or do a bioculture to see if there is any inflammation in the biosystem, because we truly do see the white blood cell getting higher, or we will do the therapeutic trial at this time? What I gonna say for me would be treat first, because for this kind of disease, or for this kind of patient, treatment would be more important thing. We're gonna talk about 10 rules about the treatment, how to treat the disease, and if there's any tips for this kind of patient. First, the most important part would be fluid, because through the physical exam, we know captain is in a very dehydration status, and the dehydration will cause head attack, and just like human after drunk, and people will wake up in the second morning. There will be severe headache, not only because of the alcohol, but also because it's humans' body is pretty dehydrated. Dehydration will cause head attack, and also will make the nausea and the inappetence more easily to happen, make the condition getting more severe. As we know, the appetite would be more important thing, and it will cause lethargic and makes the cat more grumpy, also makes a constipation happens. So I want to say, what would be the first sign for the owner to see if the cat is suffering from dehydration? Would be the skin tint skin getting more dry, or the gum mucus, or the sunken eye? No, for the pet owner to monitor to see what is the most first sign being noticed would be the constipation, because the fluid in the rectum, a fluid in the colon for the feces will be absorbed very quick, because the body is in a dehydration status. So the colon will absorb more water from the feces, then make the constipation happens. So that's a part we always need let owners to know, to monitor, and we also need to have a look if the cat is in a constipation status. What kind of fluid we gonna use for this kind of animal, for the liver disease animal? First, we cannot use contains glucose fluid, because the the metabolism, the glucose will need the liver to go to work. At this time, we need liver to getting more rest. So the right now, if we give too much glucose, will cause too much glucose will make the liver to do more work. And also, if we need to use a non-lactate containing fluid, like lactate ringer solution, the previous information, the previous lecture told us the lactate will also metabolized in the liver tissue. So do not use contains a lactate fluid to give the infusion for the hepatic lipidosis cat. But also recently there are some lectures, there are some books tell us that the lactate in the body would be 90%, 80% to 90% of lactate will be metabolized in the muscle system. So I would say it's okay, it's acceptable to give the to use fluid like lactate ringer solution to give the treatment. But if it's okay, if it's better to use non-lactate containing fluid like ringer solution would be better. And also how much fluid we need to give. So there are some different kind of calculators you can find through the website. I use it from the VIN, the website. We can count how much what's the body weight is animal, how much how dehydration, what's the degree of the dehydration for animal as well, and how long you will want to rehydrate the animal at the same time. So at a 4 kg and 8% dehydration cat, we will use 24 hours to rehydrate the animal. Commonly we'll need 22.7 ml per hour fluid to do the infusion, and for the maintenance rate would be 9.6 ml per hour. So need to get the animal to getting rehydrated would be pretty important. And the second part would be correct the serum potassium, because it's very, very easy to see the not eating the hepatic lipidosis cat, they haven't been eating for a very long time. Where the body gets the potassium from the food. So not eating food cat, they are very, very easy to suffering from hypokalemia. This is a negative predictor for survival. And also, if the potassium level is high, is low, will alter the neuroreception response threshold, make the cat getting more like lethargic, and not will be more not willing to was the appetite were getting worse, not willing to eat the food. So we need to do the correct the potassium at the same time. We can add the chloride, potassium chloride in the infusion fluid to correct the hypokalemia. If this is an important thing. I know there are some hospitals or some cases, it's not easy to check for the potassium chloride every time or the potassium level every time. So for this kind of case, I will just routinely give some potassium in the fluid, maybe not a big volume, maybe like just a 10 MEQ in like 1 liter ringer solution to give the infusion. Because we know this kind of case, they are very, very often to suffering hypokalemia. And also there we can check for the clinical sign. If the animal is getting a high, there is one thing we need to be sure to check if you want to put the potassium in the fluid, is the cat is not in a hyperkalemia. There are some clinical findings of physical exam findings to help us to temporarily rule out the cat is not suffering from hyperkalemia, is to check the heart rate. Because I think we all have the history, or we all previously done the euthanasia for animals. If we give the potassium chloride in to the animal, the heart rate will getting low very quick, and the heart will stop beating. So if you check the heart rate for this animal, the rate is lower than normal, then just do not put potassium chloride in the fluid. You better to check the potassium for this case, for this patient. And anytime you check the electrolyte for not eating well case would be a very good choice. And the third rule would be correct the serum phosphate. We can see the blood work of captain. The phosphate is still in the normal range, but at the same time, the other kidney values are very high because of the dehydration. Commonly, the creatinine, urea, and phosphate will evaluate at the same time, but the phosphate still in the normal range or low normal because the animal haven't eaten for a while, for a long time. So she cannot absorb enough phosphate. Hypophosphatemia is often very easy to see for the not eating well cases, not eating well cats. So we need to check if there's any hypophosphatemia. If there is truly hypophosphatemia, if it's low enough, will cause the red blood cell rupture because will make hypophosphatemia will make the membrane of the red blood cell getting worse, so makes a rupture of the red blood cell happens. So we need to prevent that. We need to give the phosphate if there is truly like hypophosphatemia. So in China, what we do have is this 1-fructose sodium diphosphate. It's five 50 mils have the 5 grams of this medicine, and it means like 18 millimole. And we can use this chart to calculate how much to give. Commonly, we will use CRI for 6 hours and avoid administration. We need to take care, avoid to administration with IV calcium, because calcium will have the reaction with phosphate and makes a sediment happens. And if it's just a mild phosphatemia and there is no clinical sign, we can give the oral phosphate like 0.2 to 2 millimole per kg through every 24 hours. There is some food like milk product contains like cheese or milk contains more phosphate. So feed the animal some milk would be the option as well if it's a mild hypophosphatemia. And for the number rule, we need to stop the nausea, stop the vomiting, because if the cat is continuously feels nausea, want to vomit, the appetite wouldn't go back. So we need to stop it. The first thing, as we talked previous, is rehydrate. Rehydration would be very important to stop the vomiting, stop the nausea. And the second, we can use antiemetics medicine. And in our clinic, we will more commonly to use Serenia, the maropitam. It works pretty well. And also, we can use H2 agonist or PPI. But there some literatures has been published several years ago. Compared to this kind of medicine, H2 agonists like famotidine, ceratidine, they are the medicine effect cannot last very long. They can be effective very quick, but the duration cannot last very long. So like you use the medicine for 2 days, 3 days, and it's not work anymore. But as PPI like omeprazole, it getting effective will take a little bit longer, maybe like 2 hours, 12 hours or 24 hours to getting to truly lower the acidosis of the stomach. But they can make the effect of the medicine getting longer, can last for like weeks. And when we can use like H2 agonist medicine like cimetidine, famotidine, I will use in one scenario, in one situation, is once we are doing surgery, the animal have been regurgitated. The animal have regurgitation. The stomach fluid go to the esophagus. We know the stomach fluid go to esophagus will cause the burn of the stomach because stomach fluid is very acid, and if didn't treat or didn't prevent it will make the esophagus getting inflamed and sometimes inflamed. So if the stomach regurgitation happens during anesthesia, we need to flush the fluid to make the acidosis resolved, and at the same time we can give one shot of the cimetidine or famotidine to make the stomach acidosis getting lower, to prevent the further damage of the esophagus at the same time. But otherwise, for other diseases like chronic vomiting, like stomach issue, I will always choose PPI, and we need to use omeprazole at 1 mg per kg twice daily. Do not give once daily. Twice daily would be the more effective way to give. And rule number 5 would need to be give adequate balanced calories. For hepatic lipidosis case, the most important thing would be food. So it's sometimes doesn't matter you give what kind of liver supplement or what kind of specific liver treatment. As for hepatic lipidosis cases, the food would be the most important part, because the energy, the liver will need energy, will need protein to metabolize the to metabolize the fat tissue, the fat in the liver cells, to make the lipolysis happens, to make the condition getting better. So we need to feed the animal first. We need to put the diagnosis even later. So how before we give the commonly, there are several methods to make the not eating cat start to eating. Despite the previously we talked, we can use the rehydrated animal, make the nausea stopped. Also, we can use some appetite stimulant, like cryptohepatadine, septohepatadine, or the mirtazapine. And also there are some new medicines like capromorelin, or there are some researchers told us the meropenem also can be used to stimulate the appetite. But there are some lectures right now. There are only 2 medicine is sapropeptidine, and also the mirtazapine will be recommended to use to stimulate the appetite. And also, I will use vitamin B12 very often. It's there are also some effect to stimulate the appetite as well. And in the beginning, once the animal is hospitalized, in the beginning, maybe 36 hours to 48 hours, I will start including we will give the other treatment. I will start with oral feeding, because there are several other ways we can choose to feed the animal except the force feeding, syringe feed. There are like nasal tubes, or the esophageal tubes, or the stomach tubes. The nasal tubes is less. It can only last for like 5 days, but it's inexpensive. While the tube itself is very small, so only a little bit or the very indense fluid material can pass the tube. So it's not liquid diet can pass. So it's not commonly be recommended for hepatic lipidosis cat to use, because most or many of the hepatic lipidosis cat, fatty liver cat, they will keep not eating for a very long time. Sometimes even for like 1 month or 3 to 3 months or several months, they keeps not eating. We need to feed them for like very long time. So the nasal tube is not an ideal choice. Then for this kind of situation, I will definitely choose esophageal tubes as a choice. But why I didn't put the tube in once animal is hospitalized, I will start with oral feeding, the syringe feed force feeding first, because the animal is not in a stable condition. She is pretty dehydrated, and also because the animal is not eating for a while, they are very easily to develop the vitamin K, and will make the coagulation system getting worse. So we'll need to stabilize it first and give some syringe feed to see if the animal will start to eat by herself. If not, like wait for 1 day or 2 days, then we'll put the esophagus tube on. And also, feeding via large bone feeding device tube will increase the chance of survival. And here I'm gonna show you how to place the feeding tube. Sorry. Okay. So here is a video showing us how to place the feeding tube. Let's have a look. It's from Royal Canin.
This video will demonstrate how to place an esophagostomy feeding tube in a cat. Several techniques are available, but this video will show the technique using curved forceps. Equipment should be prepared and include materials to clip and aseptically prepare the skin, a feeding tube size 12 to 14 French, depending on the size of the cat, a marker pen, tape, scalpel handle, suture material, curved forceps, Carmel for example, needle holders, small forceps for suturing, an empty 5 ml syringe, a drape, sterile gloves, and sterile swabs. The cat will be anaesthetized with an endotracheal tube in place and placed into right lateral recumbency. Measure the feeding tube from the mid-cervical esophagus to the 8th intercostal space and mark the tube. The left lateral neck has been clipped from mandibular ramus to the thoracic inlet and extended to the dorsal and ventral midlines. The area is prepared aseptically. The correct site for tube placement is identified in the mid-cervical esophagus, avoiding the jugular vein ventrally as indicated. Forceps are inserted into the cat's mouth to the mid-cervical region, and the curved tips push dorsally to tent the esophagus towards the skin. The tip of the instrument is identified by palpation and a small incision made through the skin and the esophageal mucosa onto the tip of the forceps. The incision is extended to allow the forceps to slightly protrude from the skin and open enough to grasp the end of the feeding tube. The end of the feeding tube is grasped in the jaws of the forceps, which are closed. The tip of the forceps with the feeding tube is pulled back into the esophagus. The tube is pulled along the esophagus and out of the cat's mouth with the closed forceps. Hold on to the other end of the feeding tube to avoid inadvertently pulling the entire length into the esophagus. The forceps are now opened and the tube released. The tip of the feeding tube is now curled back into the cat's mouth and fed into the oropharynx using fingers, or the forceps can be used to direct the tube gently, avoiding any trauma to the mouth. Take care to avoid the tube becoming tangled with the ET tube and the securing tapes. As the tube is passed into the esophagus, the proximal end coming out of the neck is gently pulled. This results in the tube straightening in the esophagus and is felt as a subtle flip. The feeding tube should then pass easily further into the esophagus. Pass the feeding tube up to the marked level. Check the oral cavity that no tube remains. The incision site should be re-prepared aseptically and gloves changed if they have been in the cat's mouth to minimize contamination. The tube is secured in position with a finger trap suture, avoiding over-tightening of the sutures in the skin to maintain the cat's comfort. This may be done before or after checking tube position, for example with radiography. But do take care not to dislodge the tube if the cat is moved when the tube is not secured. Then, placement of the feeding tube is checked with a lateral thoracic radiograph, ensuring it terminates in the distal third of the esophagus. Other methods of assessing placement include fluoroscopy or endoscopy. A light dressing or fabric collar is used to secure the tube in position and should be checked to ensure it's comfortable for the cat and not excessively tight. Analgesia should always be provided.
Okay, that's the method how we put the esophagus tube, and the thing is, this is after the esophagus tube. We can see the animal. We can see the esophagus is in the 7th to 9th intercostal space, so it's in the right place. And then we need to decide what to feed. Is restricted protein diet like hepatic prescription diet would be okay? Or we choose, as this a hepatic disease animal, or we choose a high protein diet, low carbon diet, or anything she want to eat would be better? So generally, I would say we cannot give a hepatic prescription diet because this kind of diet commonly with low protein. And we know that the liver is right now need more protein to have the energy to metabolize the fatty tissue in the liver. So we need to choose either anything she want to eat or high protein diet would be better. And how much is enough? We need to calculate. So commonly we will give 40 to 60 calories per kg ideal body weight per day. For senior cat would be the 70, and we can calculate also. There is some website through the body weight. Type the how many times you can feed and what kind of food you can provide it, and if need to be diluted, we can check like if every 4 hours first a day we will feed 20 meals per day if the food is diluted in 100%, and how often to feed. It's depending on calorie requirement and the volume tolerance. In the beginning, we will give 6 meals each time. And depending on the cat, if can tolerate the amount, we can increase by 6 meals every time to commonly to 36 to 50 meals for most of the cats. The tolerance is very variable. Some cats, especially in the beginning stage, they cannot tolerate more amount. So need to be patient. Do not be need to be patient to do step by step, increase the amount gradually. And also the appetite stimulant we talked previous already. And also, why we'll need to give the supplement of vitamin K1? Because it would be easily to have the vitamin K deficiency within 7 days the cat is not eating, because the vitamin K is absorbed from food, from intestinal, and also vitamin K1 is from food absorbed. Haven't eaten for several days, so no K1, and vitamin K2 is you will need bacteria in the intestine to synthesize. But commonly we will give antibiotic, and the microflora in the intestine would be abnormal. So vitamin K1 is low. Once the vitamin K is lower in the range, will cause coagulation issue, will make the either extrinsic or intrinsic or common pathways coagulation and cascade getting worse, getting abnormal. So we can check PT, APTT values to see if there is any abnormalities of the coagulation cascade. We will give the subcutaneously vitamin K1, 1 mg per kg every 12 hours for 3 doses. And once the animal is hospitalized, and after the 3 doses, if the animal is still not eating, then we will plan for the surgery for the esophagus tube. And also, the Bioguard is now having the minicam, the combination analyzer. They can do the coagulation test and chemistry test, chemistry panels just in one machine, can check the PT, APTT, fibrinogen, and also the electrolyte, and also all the parameters you will need to use in the clinic, even the bile acid. So it's a fantastic machine. If you have any interest, can contact with a Bioguard company anytime. And the numbers rule 7 would be looking for the underlying causes of the hepatic lipidosis. I would say 75% of the cause are secondary, either due to the upper respiratory disease or neoplasia or renal disease, or more likely due to the cholangiotitis or choroiditis, which means bowel disease, inflammation bowel disease, pancreatitis with hepatic cholangiohepatitis together. So there, we can have a look at the liver enzyme. For captain, the gamma GT is getting higher, but the ALKP is normal. We increased ALT and ALKP, and gamma GT will suggest cholangitis. But commonly for the lipidosis cat, the ALKP will higher than the gamma GT. This case, gamma GT would be higher. And also we do see previously the blood work. There are some white blood cell, and also in the gallbladder there are some sludge. The gallbladder, we will suspect it's the cat also suffering from cholangitis. Because the intestinal, the gallbladder, the bile duct is opening is in the intestine, in the duodenum, and the bacteria will have the chance ascending to the gallbladder system, cause inflammation. And if there is any bacteria in the gallbladder system, bilirubin system, or in the gallbladder, will cause some sludge in the blood. That's what we see in the ultrasound as well. So for this kind of cases, what I will do is starting to give antibiotic, includes metronidazole and amoxiclav at a sick liver dose. It will be 7.5 mg per kg twice daily for metronidazole, and 15 mg per kg then twice daily for amoxiclav. And rule number 8 would be supplement with water-soluble vitamins. That is vitamin B12. It's a very, very helpful vitamin. I will use for every cat which is suffering from gastrointestinal signs or the appetite is not good. Once the medicine being given, the clinical sign will getting better very quick. And if there is any signs like cervical ventral flax, which means the cat cannot lift up the head properly, I will also give the thiamine, that is vitamin B1, at the same time. And the dose of the vitamin B12 would be 250 make sub-Q once a week for 6 weeks, and I may use more often in the beginning days, maybe once daily. And rule number 9 will give the liver supplements, includes SAMI, includes salibin, includes L-carnitine, and L-carnitine, and also urso. This is a dose, and you can give at the same time as well. And rule number 9 would be need to aware of the anemia. Through the blood smear, we can see this is after the hospitalization for like 5 days. Previously, Captain's HCT was 31.3. Right now, the number is dropped to 18.9. It's suffering from like anemia condition, and also we see the blood smear. We can see the ghost cells, and also contained here would be the Haynes body. Why this will happen? It's because the hepatic lipidosis or liver disease cat, they will alter the cholesterol and phosphate lipid metabolism and make the red blood cell membrane getting less flexible. And once the oxidase stress happens, will make the red blood cell rupture. So it'll be very easy for hepatic lipidosis or liver disease cat to have anemia and hemolysis. We need to be aware of that part. Even some severe fatty liver cats will need the transfusion for several times. And what we can do is we can give some vitamin E, because vitamin E can make the membrane bound, the antioxidant, make the membrane getting stronger. The dose can give 10 units per kg once daily. And after these time rules of the treatment and the hospitalization, after 3 weeks, Captain, the blood work go back to normal. The liver echogenicity decreased. This is 3 weeks ago. This is right now. The echogenicity go back to normal as well. And there is no gallbladders large being detected. The liver and also the kidney value and also the electrolyte and inflammation condition getting normal at the same time. And 1 month later, because the cat's appetite is can eat by herself, and there is no need to feed any food from the tube, and then we remove the tube. But we can see there is some alopecia in the skin, on the skin. I've checked that there is no fungus infection. There is no like skin in disease, but mainly due to, I would suspect that due to the malnutrition, there is no enough like fatty acid being absorbed, or the fish oil being absorbed, make the skin getting very easy to lose hair. And after 1 month, 2 months, hair grow back again after we manage the nutrition part. So generally, that's my presentation, my talk today. And if there's any further question, we can talk a little bit right now. Okay, let me check. Yeah. Diazepam, can we use diazepam as appetite stimulant in hepatic lipidosis during his recovery? And if he is dropping the appetite, or any other suggestions? I'm not sure. I haven't seen any information about diazepam, and also diazepam is a medicine will be metabolized in the liver, and commonly, even if we need to do the anesthesia for the liver disease cat, commonly I may not choose diazepam as my first choice, because it may increase the risk of the liver damage. So as a appetite stimulant, more commonly I will still use mirtazapine. And if you cannot find the mirtazapine, I would say the cyproheptadine would be the other choice, or the Serenia. Yeah, that's my answer. If there's any other commonly for the antioxidants. So first, for hepatic lipidosis case, the antioxidant would not be the most important thing. The most important thing is still more energy, more food, feed the food, feed the food, feed the food. Give them enough energy, make them have time to recover. That would be the more important thing. And for the cysteine and vitamin C, it's okay to use, but I would say it's less specific in my knowledge, I would say less specific for liver disease. And this kind of product like SAMI, like silibin, like L-carnitine, or even taurine has some studies being published. Especially the L-carnitine, there are some literatures being published in human as well. They said the L-carnitine is a good product to make some liver enzymes getting lower for some liver disease cases. And the other thing is silibin. This is a more strong form from the milk thief, and the milk 70% of the milk thief can be metabolized as silymarin, and silymarin 70% of the silymarin can be metabolized as silibin, and the silibin would be the most potent form for liver issue. So I would say I would probably, if you want to choose a form, I would say better to use silibin would be a better choice. Can we use painkiller during situation? Yes, I would say painkiller would be a good, is important. The pain management would be important. But what kind of medicine to choose? Will you use NSAID? If you need to plan to use NSAID, you need to use a very comfortable or very safe dose. Otherwise, sometimes may cause liver damage. In the beginning hours, I may choose to use butorphanol to manage the pain. Also, sometimes butorphanol may make the animal a little bit sedate. It's also a good, it's also a good thing if the animal is very stressed. Why protein is more important than carbohydrate? Because once the cat is in a liver disease, hepatic lipidosis, they will have the chance to have the insulin resistance. Because we can see the blood glucose getting higher in this case. Once they have the insulin resistance, if we give more carbonate, will make the blood glucose getting higher and makes the whole body condition getting worse. And also, the liver itself will need energy. will need energy to run to metabolize the fat tissue in the liver. The energy resource is mainly from protein, not from the carbohydrate. So we need to give enough protein to these kind of animals and to make the metabolism of the liver getting recovered better, and to remove the fat tissue in the liver. Yes, I think that's it. If there's any other questions. Okay. Thank you very much. Thank you very much for listening this lecture. If there's any other questions, we can communicate maybe through the email, we can and also I will prepare the PowerPoint and let Robert to send it to your emails if you have interests. Thank you for your listening.
Yeah, thanks, Dr. Cao, for delivering the insightful presentation regarding how to deal with hepatic lipidosis in cats. And thank everyone for participating in today's webinar. And we'll see you again next month. Thank you and good night.